When you finish with that, I suppose you're gonna clap, huh?
Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease specialist and HIV specialist, as well as professor of medicine. So today we will be talking about chlamydia. Our last few shows were focused mainly on sexually transmitted infections that has ravaged our communities, not just here in Memphis, Tennessee, but all over United States and all over the world. And what is really baffling is that this is something that is destroying our younger generation, our younger kids. And so what I wanted to do was kind of create some awareness about what these infections are, what we can do, and how we can protect ourselves. So we will talk about chlamydia. I'm sure most people have heard about chlamydia. If you're sexually active, you need to know about chlamydia. So this is a bacterial infection that's caused by an organism called Chlamydia trachomatis. And what it does is that it's kind of, an infection that you can pass from one sexual partner to another. It is the commonest STD or STI. So some people say STD, sexually transmitted diseases, others say STI, sexually transmitted infections. Whichever one you choose is fine, but it is the commonest here in the United States and also all over the world. You have more than 1 million, actually about 1.5 million people affected yearly. And when we talk about this population, we're talking about the younger ones. We're talking about our teenagers from the ages of around 14, 15 years up until 24, 25 years. So what I'm sure, people listening are like, wait, how is this possible, right? So we're talking about our high schoolers here. We're talking about our college kids, right? Your 14-year-old, your 15-year-old daughter, your 16-year-old, son, and then up until college. So how is this happening? Why is the rate so high? I mean, we're talking about millions of people here, and then we are talking about the younger generation. So let's talk about what this infection is, how we can get it from person 1 to person 2 to person 3. So we already said that this is an STI, meaning that it's something you get during sexual intercourse. And it doesn't matter what type of intercourse we're talking about, the normal, vaginal, penile thing. It could be oral, it could be anal sex, whatever type of sexual activity, as long as there is exchange of body fluids between two people or multiple people, then you would remain at risk for this infection. So let's talk about the risk factors. What are the things that would place you and place me at risk for contracting chlamydia? One would be, young age, less than 25 years of age, which is where, again, we talked about it's going to be our teenagers and our college kids. And then we have, different sexual practices like having multiple sexual partners, presence or history of a previous STD would place you at risk of contracting this infection. And then if you are not using protective methods, protective barriers such as condoms, then it could be male or female condoms, regardless of the type of protection it is, then it kind of puts you at high risk. So, because here's the thing, let's assume that is, somebody, a young kid who has never, had any kind of sexual activities, and now, is dating this guy or whatever, and, you can pick it up because you can vouch for yourself, but, you don't know the history of the next person. Why is this important? Let's talk about the symptoms associated with this infection, chlamydia. Majority of the cases, up to 50% of cases of chlamydia are asymptomatic, meaning that they don't have any symptoms. So you don't even know that you have it, right? So majority of what we see is accidental transmission, where not because, I came out today and decided, hey, I'm going to give you chlamydia or I'm going to give you gonorrhea. No, that's not it. You didn't even know you had it. And then you are involved with somebody else. And what happens is that you end up passing it on to this person. You guys might break up or might continue to see other people, and it goes from one person to the other, from one person to another. So that's kind of what the major, mode is, when you don't even know you have that infection because you were not having any major symptoms. Now, for people, the rest of the population that might have symptoms, what kind of symptoms are we talking about? It's something that when we say it's non-specific. So there's no particular symptom that you will say, oh, once I have this, I know I have chlamydia. Once I have this, I know I have, HIV. Once I have this, I know I have gonorrhea. Unfortunately, that's not how it works, because majority of these STIs, they kind of have similar presentations and similar symptoms. So we're going to break it down and talk about the kind of symptoms we would have in women and we will have in men in certain scenarios. Okay, so let's talk about something like, the traditional, sexual intercourse between a man and woman. The woman, you might notice that you have some pain that shouldn't be there. We call it dyspareunia, where you, for instance, have pain with sexual, intercourse. Or you might have what we call urinary symptoms, dysuria, which is pain when you're urinating, and you're like, oh, this is not right. Like, I wasn't having pain before. Why am I having pain? Or you can have some discharges, right? It could be clear. It could be, watery. It could be creamy. Everybody's body is different. But then you know that something's not right. Then for those, for instance, then women also, or girls, you can have pelvic pain. All right, that's when you have pain in the lower part of your abdomen and you're not in your period, or there's nothing to explain why you're having this pain. Then thinking about an STD is very, very important, especially if you're sexually active. For men, the commonest symptoms is going to be discharge from the penis, especially when you're trying to pee. Or you could have painful urination. You're trying to pee and you're having this burning sensation. You're like, why am I having this pain? Or you could also have pain around the scrotal area. So let's talk about the symptoms that you could have during oral if you're involved in oral sex. So if, for instance, what your sexual preference is oral sex, then the symptoms you're going to have would be things that would occur in the oropharyngeal area, meaning in the mouth and throat area. So the commonest thing would be like sore throat, right? You're like, you're going, because something is wrong with my throat. You could have sores, sores around your lips. You have sores inside your pharynx, that's inside your throat. And then you could have mild grade fevers. And then what we call lymphadenopathy, which is where you have swellings of the lymph nodes around the throat areas. Once you have that, you know something is wrong. And then it will be time to see your doctor. So what about, hey, Dr. Animalu, something like, anal sex? Then you're going to worry about, again, discharges. You're going to have rectal pain. The rectum is where, you poo from, that part of the body. You could have a lot of pain, a lot of bleeding, a lot of redness, and then you can tell that something is wrong. Like I said, it is so hard to differentiate chlamydia from something like gonorrhea. And, other STIs, they tend to kind of have the same thing. That's where it's so important to go to your doctor, go to a health clinic, a health center, and get tested. So now let's talk about, special populations. We're going to take a short break, and when we come back, we will talk about this kind of infection in special situations like our immunocompromised folks or pregnant women. So this is Medical Class 901 with Dr. Chi. We will be right back. This is Dr. Chinelo Animalu, the host of Medical Class 901 with Dr. Chi, and this is the show that talks about the major infections that plague us here in our Memphis community. So please make sure you tune in every Sunday at 6:30 to get a glimpse of this class. See you then. We are back. Welcome to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease and HIV specialist and professor of medicine. So today we are talking about chlamydia as the commonest STI or STD that we have in our community here in Memphis, as well as all over the United States and all over the world. So there's something that kind of hits me really hard. Obviously, I'm a Black woman, and so anything that does affect our community, is something that I'm really, really passionate about. So when you talk about, we already, established that about 1.5 million people are affected, with this STI yearly. And, what again, I don't know if I should say it's surprising or not surprising, I'm not sure, but the Black population or the Black community seems to be the most affected. And so it has me thinking, what are we doing wrong? Why should it be that way? And again, we did talk about that, it's a young, generations. We're talking about 15-year-olds, all the way to 24-year-olds. So we're talking about our high schoolers, as well as our college kids. So what is the main issue that we're worried about? Why is it something that does affect the minority communities? So one would be lack of access to STI prevention resources, because, the first thing would be knowledge. I always say in my shows that my people perish for lack of knowledge, which is why we're here, sharing this so people will know that things are out there and will know how to protect themselves. And then it's also worse in communities with less sex education and barriers like condoms. We know that there are places where they, some of the health centers here in Memphis where they give out, free condoms and, other barrier methods, for sex. And what's the use of this, just to prevent this infection, because it does have long-term sequelae that I will talk about in a minute. So what does chlamydia cause? We've already talked about, the STIs, the infections, and then things like PID and infertility that I'm going to talk about in a minute. So I'm going to open this up to the audience and have questions, kind of see where people are and what their concerns are.
How would I know if I have chlamydia?
Yeah, good question. It's how would you know if you have chlamydia? How would I know if I have chlamydia? I might not know myself too. So that's a very good question, because as we talked about, chlamydia, just like other STIs, most times do not come with symptoms. And so you know your body best. So one thing I can say, I can advise would be, even if you're not having any symptoms and you are sexually active and you are having unprotected sexual intercourse, you need to figure out a way to have yourself tested. Either go to your doctor's office. If you're a lady, you can go to your OBGYN office. If you don't have that, we have health centers. So the only way for you to know is by getting tested. So if you, for instance, have a new partner, or you're going to be involved with a new partner, it would be nice to have both of you go check out. And that way, if anybody has anything that they do not know about, then you guys can take care of it. So it's not something, like I said, it's not something that comes with, specific symptoms where you say, oh, once you have this, then it means, boom, you have chlamydia or you have gonorrhea. Some of those symptoms, again, that I did talk about, like, the painful urination, or you could have some bleeding, some pelvic pains. There are other things, a million other things that will give you that symptom. So the best way for you to know is to get tested. Any questions?
Yes, ma'am. I tune in weekly to the medical class because I do enjoy it and I do learn a lot. So last week, I believe you and Dr. Kitson was on the show. She was your guest, rather. And you all was talking about disparity. And so is there any way that this information can be basically taken to the street, if you will, for those people who are living in disparity, who are not low information, if you will? I mean, because they're sexually active, right, but they don't know to go to the health department. A lot of people don't even know these things are available to them unless they watch a medical class 901 or something like that. So do you, as far as the medical community, are you all thinking about how can we reach those people that are really living in disparity?
Thank you so much for bringing up that question. And this is something that's also very close to me, and which is the reason why we are here. I'm a practicing physician, and I work out of one of, if not the biggest hospital system that we have here in the Memphis system. And I see these cases on a daily basis. And one thing that that's very clear to me is that lack of information or misinformation, because most times when I get the chance to talk to my patients, they have absolutely no clue what I'm talking about. And so this is the reason for this show. This is the reason why, again, this is my specialty, this is what I'm trained to do. And the fact that I see it on a daily basis where people are not taking care of themselves, not because they don't want to do that, but because they didn't know how to do it. And so this is something that as a community, as Shelby County Health Department, other health departments, we have to figure out a way to educate our masses, to get this message across to people on the streets, right? Hey, because again, somebody might not know, right? Like I talked about, that, oh, when you do this, this can put you at risk for this. And we're not just talking about chlamydia here. We're talking about other STDs, the worst of which is HIV, because it has no treatment, right? So this is something that I am hoping that we can collaborate with the major hospitals. There are other doctors here. We have other infectious disease doctors. If we need to take these messages to the schools, we just need to kind of sensitize our young folks who are the ones that are actually suffering from these infections, and then people out there in the streets kind of know the things that put them at risk for contracting any one of these infections.
Okay, I have a follow-up question as well. When people are living in disparity, and especially, in Memphis, sometimes people feel like nobody really care, or does incarceration, if you will, is that in any way linked to some of the STDs, like when people go into a corrective system, I guess, if you will, and come out? Is that any way linked?
Well, because what happens is that when someone is incarcerated, one thing I know, for instance, is that they at the time that when you're going in, they do check for, some infections, especially things like HIV. And then when somebody comes out, it's hard to tell what exactly is happening in there, okay? And also, when somebody comes out, I don't know if it's something, I would say that it's something that's just, particular, or that, just, affects this population. I feel like whether you're incarcerated or not, okay, the rule applies to everyone. The same thing applies to everyone. So even if you're, you've been incarcerated, and you come out, there's so many things that happen in our prison systems that we would not even talk about, in these shows, different types of sexual practices, and all that. But the most important thing is that when that person comes out, again, get tested. If you were sexually active or had any kind of, sexual, relationships with someone while you were in the prison, then when you come out, you still need to get tested. So that brings us to what we'll consider as the complications of chlamydia. So, so let's say now that we've talked about it being asymptomatic, meaning that you don't even know that you have the infection. So what happens? So a question would be, somebody would wonder, okay, Dr. Tommy, I didn't know I had this infection. Like, what can go wrong? What can happen? Okay, so for women, the greatest thing would be when you develop what we call a PID. PID means pelvic inflammatory disease, which is basically an infection of your reproductive system that, can affect the uterus, the fallopian tubes, and, every part of your reproductive system. And this is when you've had this infection for a long time and it was untreated, meaning you didn't get any treatment for it. And so even though this is something that definitely will land you in the hospital because it comes with severe pelvic pain, it will come with fever and sepsis. So usually for somebody that has that kind of symptoms, you're going to end up in the hospital, and that's how, we're going to find out, oh, this is what you have, and then we'll treat you with antibiotics. The sequelae of having PID for women is infertility. This is a very, very unfortunate complication of having untreated STDs or STIs. Because even though it's silent, it's not giving you all these major symptoms, it still doesn't mean it's not wreaking havoc on your body. Okay, and so you see a young woman, maybe you're now 26, 27, 30 or whatever, you're trying to have kids and, you're not getting pregnant, and then you go into the doctors and they say, hey, you have a blocked fallopian tube, and you will be in shock. Like, what does that mean? Like, how did this happen? The commonest cause would be untreated STIs. It doesn't matter if this is, chlamydia. It doesn't matter if it's gonorrhea. It could be other types of, STIs. So then other complications, would be, for instance, a pregnant woman. I want our women that are watching this show to pay attention. I'm not sure there's any woman that would want, to go out of their way to pass an infection to their unborn baby. But all these STIs, unfortunately, the mother can transmit this to their baby during childbirth. So for pregnant women here in the United States, at least if you're getting your normal, antenatal care, prenatal care, and all those things, they would always check you during a course in your pregnancy, do an STD panel, make sure there's nothing wrong. If there's something wrong, they go ahead and treat you before you go into labor and give birth to your baby. So now let's say you have this scenario, an uninsured woman, young lady with no insurance, and doesn't have an OBGYN, and so was not going to see the doctors regularly, and is now in labor and is giving birth to a baby. What are the chances that she could pass something down to the baby, because she didn't know she had anything in the first place, right? So the government has something in place where children born here in the United States receive what we call prophylactic treatment. Prophylaxis means preemptive treatment. So you're just going to assume, oh, we're just going to cover you regardless. Whether you have it, you don't have it, we're just going to go ahead and treat and assume that you have it. That way you keep the baby safe. All right. So for women, if you're pregnant, please do everything possible to establish care with an OBGYN doctor. If you're unable to do that, especially let's say you're getting towards your second, third trimester, go to any of the health centers that offer free services to pregnant women and get tested. So if there's anything that's wrong, it could be chlamydia, it could be gonorrhea, it could be HIV, it could be syphilis, right? Any of these things would affect your unborn child. You go get tested and then you will get treated. So we're going to take a short break. This is Medical Class 901 with Dr. Chi. We'll be right back. Welcome back to Medical Class 901 with Dr. Chi. I am Dr. Chinelo Animalu, infectious disease and HIV specialist and professor of medicine. So today we have been in the STI groove. We're grooving on the different STIs, and today our focus was on chlamydia. And just a quick recap, we talked about that chlamydia is the commonest STI or STD here in the United States, and does affect up to 1.5 million people yearly. And the commonest age group would be our young kids from the ages of 14 up until 24, 25 years. And so we kind of, talked about, the risk factors and, how we can contract this infection, through unprotected sexual intercourse. And so now what I want to talk about real quick would be, okay, so Dr. Chi, what happens, right? I go to a health center or whatever, and they said, oh, I have chlamydia. What do I do? So the good news is that it's not a death sentence. It's so easily treated with antibiotics. So the antibiotics we use for this is called doxycycline. You're going to need a prescription from a healthcare provider. It doesn't have to be, an infectious disease specialist. You're a normal, regular PCP or your nurse practitioner should be able to give you prescriptions for this. Duration is usually about 7 days. Now, it doesn't mean like you start taking your antibiotics and in 24 hours you feel a lot better. You're like, yeah, okay, I feel okay, I'm gonna stop. No, if you stop your antibiotics, it's gonna come right back. And one thing we encourage is not just you. If you are in an active sexual relationship with somebody or multiple partners, your partners need to be treated also. Why? Because you get treated. So let's assume you receive 7 days of doxycycline. Now you're treated, right? And you go back to, your partner who was not treated. You will get reinfected, and then we are back to square one. So it becomes like, like a regular cycle. So something we encourage, if you come to a clinic, when we treat you, we're gonna ask to treat your partner or your partners also. That way everybody is clean. Now for pregnant women, we use a different type of antibiotics called azithromycin to treat that lady, and also to prevent, when we say transmission, fetal-maternal transmission, where you transmit that infection to your unborn child or to the baby. So just to kind of give a quick rundown again, this is something that is so easily treated, okay, but you have to know first before, of course, then you get treated. So I think we have time for one more questions from the audience, so we're gonna take this.
Okay, real quickly, again, I'm learning so much. So why is it important that a pregnant woman having sex anyway, when she know that there's a chance during her pregnancy that she could end up with something, STD, to pass on to her children?
Well, you're not gonna say, oh, because I'm pregnant, I'm not gonna have sex. So again, the most important thing would be, okay, so if you ask now, what would be the best thing to do? Abstinence, but we know that's not possible, right? That's not gonna happen, especially amongst the young folks at this time. So for that pregnant woman, if you are in a monogamous relationship, so I'm gonna assume, for instance, a woman that's having that's having sex with her husband, you are in a monogamous relationship, so the risk of you contracting infection is gonna be low, unless, something's wrong with a partner. Maybe the partner is stepping outside of you. But again, if you're pregnant and you're here in the United States and you go for your normal care, prenatal care, they would always check you for any of these infections. And at the end of the day, if you go to have your baby in a hospital, they are still gonna go ahead and treat your babies anyways. So I do hope that you guys have all learned a lot from this session today. Knowledge is power. My people perish for lack of knowledge. This is the reason why we're doing this, to kind of, enlighten everybody. It doesn't matter, if you're on the streets, if you're not in the streets, if you're at home. And for parents also, if you have teenage children, regardless of if you're sexually active or not, you need to sit down and have this uncomfortable conversation with them. Let them know, especially our young girls, what they are at risk of when they have unprotected sexual intercourse. If they have to do that, ways to protect themselves by using barrier methods, abstinence, and other methods. So thank you for joining us today in our medical class 901 with Dr. Chi. Please check us out on our social media pages downstairs. You can see the link downstairs. Until next time, bye.
Thanks for watching the Medical Class 901 with Dr. Chi MD.